and good day to all examiners. My name is Iman Izatie binti Mohamad Ismail. I'm going to present to you my research titled The Profiling of Diabetes Patient Admitted in Hospital University Science Malaysia. World Health Organization has defined the diabetes mellitus as a condition when the level of hyperglycemia giving rise to risk of microvascular damage which resulting from defects in insulin secretion, insulin action or both. In fact, diabetes mellitus can cause a variety of health concerns including heart disease, stroke, kidney illness, eye problems, dental diseases, nerve damage and food problems. Diabetes is known as one of the main leading causes of death in the world. About 422 million people worldwide has diabetes, which majority from living in low and middle income countries. Diabetes affects an estimated 246 million people globally, with 80% living in the world's poorest country. And for Malaysia, reported in 2019, the prevalence of diabetes was reported to be 18.3% in adults aged 18 and above, corresponding to an estimated population of 3.9 million. Diabetes suffers require special medical attention. Different types of diabetes require different therapies. According to the current research, the ASEAN region has a large proportion of diabetes patients. Rapid urbanization, modernization, widely available of fast foods and sedentary lifestyles all contribute to an increase in the prevalence of diabetes. The healthcare and social burden of diabetes is alarming in most of Asian countries, in addition of increasing in number of people with DM and its complications. Despite the large burden of diabetes and associated complications in C region, there is a comparative lack of structured care management and integrated healthcare policies, hindering diabetes prevention, detection and management due to inadequate resource. It was revealed that the total of 1,614,363 individuals were enrolled in the registry at the end of 2019, with 897,442 of them being active diabetes patients in the National Diabetes Report 2013 until 2019, but there was no precise diabetes profile was developed. The general objective of this study is to observe the characteristics of diabetes patients admitted in hospital USM in terms of their socio-demographic and clinical criteria for diabetes mellitus profiling. And there are three specific objectives for this study, which is to determine the socio-demographic of diabetes mellitus patients admitted in HUSM, to identify the patient's clinical data related to diabetes among patients admitted in hospital USM, and to create a profile of diabetes patients as inpatient in HUSM. There are three research questions in this study prior to the specific objective. The research questions are: what is the socio-demographic criteria of diabetes patient admitted in HUSM? What is the clinical criteria of diabetes patients admitted in HUSM? And how is the socio-demographic and the clinical profile of diabetes patient treated as inpatient in the Hospital University Science Malaysia? Hypothesis is not relevant in this study, as this study used statistically data. The study of diabetes mellitus profile will give local data on diabetes patient and eventually a clear profile of socio-demographic and clinical criteria of diabetes patient treated at HUSM as a reference for hospital management to plan for the diabetes patient management admitted to this teaching hospital. Diabetes is considered one of four main non-communicable diseases, including cardiovascular disease, cancers, and chronic respiratory disease. There is mounting evidence that sex and gender variations have a role in epidemiology, pathophysiology, treatment and illness outcomes in a variety of diseases. As the prevalence of both type 1 diabetes and type 2 diabetes rises, it appears that women are less likely than males to acquire metabolic disorder. Another study also shows a prevalence of diabetes in female is higher compared to male, and this situation occur may due to women generally spend most of their time at home and less engaged with physical activities in their daily routine. Meanwhile, another study found that men shows a higher prevalence and risk of developing type 2 diabetes with a 46% increased risk in males after controlling for age and other variables. WHO statement also shows that the prevalence of diabetes in Malaysia according to gender and shows that male have highest prevalence compared to female, which is 10.2% and 9.5% respectively. The study found that the elderly has a high prevalence of abnormal glucose states, with one-third being diagnosed with diabetes and three-quarters having pre-diabetes. Diabetes affects an estimated 8.5% of Southeast Asia's adult population, or 78.3 million people. Using current fasting plasma glucose and criteria, the prevalence of impaired glucose tolerance and diabetes mellitus was found to be significantly higher in two older groups, 61% in those 65 to 74 years old and 52% in those 55 to 64 years old, than in two younger groups, 41% in those 45 to 54 years old and 36% in those 40 to 44 years old. Diabetes is chronic, progressive disease that causes severe morbidity and premature death, as well as a financial burden on any healthcare system. Diabetes is a metabolic condition characterized by glycemic abnormalities caused by deficiencies in insulin secretion, insulin action, or in some cases both. Obesity is an independent risk factor for diabetes, as it has an indirect influence on a number of comorbidities including hyperlipidemia, hypertension, insulin resistance, endothelial dysfunction, and inflammation. This is a data mining study where we utilize secondary data retrospectively provided from Medical Record Department, Hospital USM, and target population of this study was the diabetes patient seeking healthcare provision as an inpatient care at Hospital USM between 2016 until 2019. To achieve the research objective, several criteria were set to ensure the subject's data are suitable for the study purpose and hence be able to reach the target goals at the end of the study. The inclusion criteria for this study are patient diagnosed having diabetes and inpatient care. The exclusion criteria for this study are patient diagnosed for other illness and outpatient care. Medical Record Department of HUSM provide a list of all diabetes patients admitted from 2016 to 2019 upon formal request, which was attached to the ethical approval letter issued by Human Research Ethics Committee USM for this study. Data received from the Medical Record Department is in Microsoft Office Excel format, was further cleaned to ensure free of redundancy or misleading data presence. There was no conflict of interest in this study, as the data obtained from the Medical Record Department Hospital USM was kept confidential and did not contain any patient identifiers. The privacy and confidentiality of the subject data throughout the study were maintained at all the time and used for academic and research purpose only. The researcher and the supervisor only can access the information. The data cleaned were statistically analyzed by using Statistical Package of Social Science SPSS version 26.0 statistical software. Descriptive studies such as frequency, percentage, mean, and standard deviation were used to interpret the data. For specific objective 1, frequency and percentage were present in the descriptive statistic analysis for the variable gender and age. For specific objective 2, frequency and percentage were present in the descriptive statistic analysis for the variables day of in white, primary diagnosis, secondary diagnosis, and tertiary diagnosis. The diagnoses have been ranked according to the calculated frequency and percentage. Overall, female diabetes patients have a larger prevalence than male patients admitted to hospital USM. However, it's contradicted with the finding of Shepherd studies which found that boys are at higher risk of acquiring diabetes. Despite that the fact females are believed to have more sickness than males, females appear to be more informed and sensitive to the signs and symptoms of diabetes and seek healthcare more frequently than males. In other words, females have a higher risk in getting diabetes. Diabetes patients hospitalized to HUSM are mostly between age of 19 to 30 years old, but a recent study discovered that the 55 to 64 years age group has the highest prevalence of diabetes. Diabetes prevalence increase with age may be caused by the extent stress exposure, obesity, genetic factors, and the passage of time. Diabetes that developed during pregnancy accounted for the largest percentage of original diagnosis among diabetes patients at HUSM. Normal pregnancy is characterized by heightened metabolic demands on the maternal lipid and glucose homeostasis, including insulin resistance and hyperinsulinemia, particularly in the third trimester. Factors contributing to the insulin resistance or relative insulin insufficiency before and during pregnancy may cause harm and consistent risk factors for the GDM. Primary prevention of diabetes is possible by modifying the dietary intake among the population, as dietary intake play a vital influence in lowering blood glucose levels and managing blood pressure. As part of a healthy eating pattern, nutrition intervention should emphasize a variety of minimal processed nutrient-dense foods in appropriate portion size, as well as provide the individual with diabetes with practical tools for a day-to-day food planning and behavior change that can be sustained over time. Programs promoting healthy eating habits among the general public should begin at a young age and be prioritized on the healthcare agenda. The study's finding can be used to establish a baseline for improving healthcare services for diabetic individuals. It is recommended that continue nutrition education to provide and refresh knowledge on the type of foods to be consumed by targeted patients in order to facilitate treatment results. This is due to the fact that food consumption is vital in promoting a healthy lifestyle. Furthermore, using technology to provide short and efficient information may help to reduce the time spent on this healthy promotion activity. That's all from me. Thank you.